this video, I'll be demonstrating how to do blood administration. So the first thing that I'll do is check my physician's order. I'm going to look at the patient's name, untreated dairy, and then their PIN number, and then I'm going to make note of what type of blood product they're receiving, how much blood product they are receiving, and then how long we are going to administer it for. We can also look at our patient's chart for the reason why the blood product is being ordered. There's no reason here, but we will say that the reason that the patient is receiving blood is due to low hemoglobin levels. So next thing that I want to do is check that I have the signed consent form. So we want to check the patient's name, their signature, and then the doctor has signed also the consent form, and then we want to make sure that it is up to date. And then next, I will ask a second nurse to do the checks with me. So then for my first check, I'm gonna be checking the record of transfusion against the patient's demographic info. So we know from our physician's order, we're gonna administer 1 unit of packed red blood cells over 2 hours. And then for the first check, we're gonna check our patient's name and their PIN number. So I'll be checking the record of transfusion. My second nurse will be checking the demographic sheet. So we'll spell out the last name. Last name is Antrique, A-T-R-I-Q-U-E. First name is Jerry, J-E-R-R-Y. PIN number is 261-824-735. And then my second nurse will just acknowledge if everything is correct. And then my second check is gonna be the record of transfusion against the blood tag. So I'll check the record of transfusion. My second nurse would check the blood tag. So last name is A-T-R-I-Q-U-E. First name is Jerry, J-E-R-R-Y. PIN number is 261-824-375. Patient's blood group is AB positive, and the component blood group is AB positive. So we know those are compatible. The component blood group is compatible with the patient's blood group, as well as we want to look at the donation number. So it's Z051008900445, Y in a box. And then the second nurse would acknowledge if everything is correct. And the next check that we'll do for our third check, we're gonna check the blood tag against the blood bag. So I'm gonna check my blood tag, and the second nurse would check on the blood bag. The information that I'm looking for are the patient's blood group. So we're looking at the component blood group, making sure it's AB positive, and the type of the blood product that is ordered is red blood cells, and then the donation number is C051008900445, Y in a box. And then I'll also physically inspect the bag for any discoloration, if there's blood clots that's present. And then I'll be checking the integrity of the bag, making sure that everything is intact. And then I'm also going to check the expiry date on the bag, as well as the volume that's on the bag. So then we are going to do our fourth check. So we'll do hand hygiene, and then we will enter our patient's room with our second nurse, and then we will introduce ourselves. Hi, Jerry. My name is Alex Cruz. I'm a year 3 student nurse at the University of Manitoba. I'm here to do a blood transfusion on you. I'll explain everything but first I want to make sure that I have all the correct information. So my fourth check, I will check the blood tag, and my second nurse would check the patient's armband, and we also want to have the patient verbalize or spell out their first and last name if they are able to. So can you please spell out your last name and first name for me? So for last name is Atrique, Atrique, and first name is Jerry, Jerry. And then we'll also look at the patient's PIN number, 261-824-375. So then my second nurse will just acknowledge if everything is correct. Jerry, your doctor has spoken with you earlier today, and your blood results show that you have a low hemoglobin, so that's why the doctor has ordered blood product to be transfused to increase your hemoglobin levels. And I also noticed that you signed the consent form that's in your chart when you spoke with your doctor. I just want to make sure that you still consent to receiving the blood product. Our patient would agree if they agree to it. If they do agree, then we will go ahead with the transfusion. So I just want to let you know that during the transfusion, I will be checking your vital signs frequently. So before I start the transfusion, I'll check your vital signs 15 minutes after the infusion has started, every hour during the transfusion. The transfusion is it's going to be 2 hours, and then I'm gonna check it again after at the end of the transfusion, and then an hour after the transfusion has finished. I'll stay with you during the first 15 minutes of the transfusion, and then I'll be making sure that I'll be assessing you for any transfusion reaction. So some of the signs of that can be if you're feeling numbness or tingling, if you're developing hives, if you're feeling itchy, if you are feeling very warm. So if you feel any of those signs, it's important you let me know right away. Like I said, I'll stay here for 15 minutes, but even after the 15 minutes is up and I'm not in the room, you can hit your call bell anytime to let me know. Do you have any questions for me? So then I'll also let you know that we'll be recording the blood products that you receive. We'll record it on the sheet that's called cumulative blood product record. So that just goes in your chart. So I'll just get set up here. I'll take a minute to get set up. So then I'll do hand hygiene and put on gloves.
And I will draw up my 1 ml insulin. So make sure you have a notebook.
And then I will
And we're just gonna
open up my blood tubing.
And I've also made my med label for this one. So here we have the patient's name, Scotland Bryson. The drug name is Luminal R. The dose is 100 million. The volume is 1 ml. Diluent is nothing. Concentration per ml is 100.
We will make sure that all of the clamps are closed.
Today it's due now, so we're giving it now, and I just have my signature here. So I will attach that to this syringe right here.
Make sure that this is closed.
So after that, I can go ahead. I also made my final label here, which will go to our mini bag later after we inject the medication. So on this med label, we just have the patient's name.
So that's all locked.
The drug name is
I am going to prime my tubing with normal saline to make sure that the blood product doesn't get destroyed when it goes through the filter. So I will spike my bag with normal saline.
and have my signature there. And we will also be needing another signature there after our second nurse does her check. Okay, so now I can go ahead and do my
Then I'll hang
second check.
this.
So I will be needing my mark, my med label, and
So
my
also when we walk into the room, we want to make sure that there is a prime emergency normal saline line that's available in case of any transfusion reaction. So
medication, we have
I will unclamp this. We will prime our
and on our
tubing,
med label we have Humulin R.
and then I'll unclamp
Also
this.
here on our injection label we have Humulin R. And on our CDM
We will
we've been looking at insulin
prime our filter, making sure that it's fully immersed in normal saline.
per hour. So if we look at our PDM for the recipe, it says here we need 100 units of insulin. So we need 1 ml of insulin from a 100 unit per ml vial. So I can have here my 100 per unit, my 100 units per ml vial of insulin. And I drew up 1 ml of insulin from that vial. And I also have here my diluent of 100 ml normal saline. And as you can see for our final med label here, we have our 100 ml normal saline. The dose is 100 units. And then we drew up 1 ml of insulin, sorry. And our final concentration will be 0.99.
So we want to make sure that there's no air bubbles in our tubing. And then the filter is fully submerged in normal saline.
And on our med label it says
Okay.
insulin.
And then we'll prime the rest of their tubing.
PDM,
We'll follow
recipe for
the
IV.
normal saline and make sure our tubing is primed all the way to the end.
It was ordered today, so we're giving it now.
And then
So after that, I'm just
we will make sure that this clamp to the normal saline, and then we will spike our blood bag.
and after that, I can go ahead and inject my medication into the milligram. So my normal saline just I just go ahead and then so I'm just gonna swab my foot for 30 seconds, let it dry and after that I'm just gonna inject my 1 ml insulin.
Okay, again making sure that everything is clapped. I'm gonna hang my bag.
And then we're gonna
And then
use
I'm going to remove the cap.
so we don't poke ourselves. And I'm just gonna rotate it to
And then
and after that
I'm gonna open up my clamp there as well as here. And then I'll watch that the blood, as the blood goes through the tubing. And then we'll make sure that the tubing is fully primed with the blood. So once the blood has reached almost at the end of the tubing, we'll clamp or we'll cover our the end of our tubing. And then we also want to make sure that this remains sterile. So make sure that this doesn't touch anything, or else we can put it back here because we might introduce infections. So next thing that I'll do is I will put my blood product into my pump. So we'll hit open, primary, open,
I'm gonna spike my bag.
and then the volume of our bag is 358, 358, and then the rate, we'll set it at 50 cc per hour for the first 15 minutes. And then we're going to change mode, label line to red blood cells. So select red blood cells, 358. And then we're going to confirm. And then we're gonna check our patient's IV site. So we want to assess our patient's IV, making sure that there's no bleeding, redness, swelling, and then we want to flush it to check its patency. So I'll swab the port for 30 seconds and let it dry for 15. I will use a um, flush, and then I'll get rid of the air bubbles. Whoop. And then we're gonna connect that to the IV side, making sure it's not clamped. And then we'll flush and make sure, check if there's any resistance. So there's none. So that indicates our IV site is patent.
We can go ahead.
We will remove our flash as well as the cover for our blood tubing,
My mini bag.
maintaining sterility. We're gonna connect those two together, and then we'll unclamp,
So now I'm gonna enter my patient.
and then we can press
Hand
start.
hygiene first.
And then I want to make sure that everything is unclamped. The normal saline is clamped. The blood is not
Can
clamped.
you please state your first name and your last name?
And then
And I'm just
we would check to see. We would check for 3 drips to see that the blood product is infusing. And then I would increase the rate after the 15 minutes is up and the patient does not show any signs of transfusion reactions and their vital signs is stable. I will increase the rate to 197 cc per hour for the next hour and 45 minutes. And then I would also record on the cumulative blood product record. That's it.